Hey guys, it's Fancy and you're watching the Good Wives Network. And today we're going to be diving into an often misunderstood aspect of Gypsy Rose Blanchard's medical history, the removal of her salivary glands. Now, I know we haven't been on in quite a bit, guys, making content about Gypsy. We're kind of trying to stay away from the current drama that she's involving herself in. We will be commentating somewhat on some of those incidences here in the near future. But as we're going through writing these additional books that we're coming out with here on June 24th, we have been breaking down pieces of this case. And so today, I want to talk about these salivary glands because I personally think that most people don't understand what actually took place and why it took place. So, for years, this surgery has been used as proof that Dee Dee Blanchard, Gypsy's mother, had Munchausen by proxy and forced unnecessary medical procedures on her daughter. But what if that's not entirely true? That narrative just doesn't hold up at all. Gypsy has a rare chromosome deletion, 1q21.1 deletion syndrome, which is known to cause legitimate physical and neurological issues. And we've talked about those in the past. One of these is Sialorrhea, or excessive drooling. But in recent years, Gypsy has again rewritten the story. She now claims her mother caused her drooling by rubbing Orajel on her gums. Yes, you heard that right. And this supposedly led to her salivary glands and teeth being removed. We're going to unpack that, the medical truth behind Sialorrhea, why this surgery was absolutely necessary, and how Gypsy's reversionist version of events isn't just misleading, it's dangerous. Let's dish. Sialorrhea is a real medical condition. It's excessive saliva production or the inability to properly control swallowing, which leads to drooling. It's not just embarrassing. It can cause skin breakdown, aspiration pneumonia, and significant social isolation. In children or adults with neurological disorders or genetic syndromes like Gypsy's 1q21.1 microdeletion, it's a common and very serious issue. She had real symptoms, real challenges, and yes, she received real medical intervention. In her 2023 People interview, Gypsy confirms that 2 of her salivary glands behind her neck were removed. She said it was painful. No surprise there, but here's the kicker. This wasn't done to hurt her. It was done to treat a genuine condition backed by medical records, diagnoses, and viable and visible symptoms. Now, here's where things get unhinged. Gypsy now claims, dead serious, that Dee Dee caused her drooling by smearing Orajel on her gums, and that the doctors, seeing the drooling, were tricked into removing not 1, but 2 salivary glands and pulling her teeth. However, this happened over several years, so I don't know how this story could even possibly be true. But let's stop right there. Fact check number 1. Orajel is a topical anesthetic. It numbs the gums. It does not increase saliva production. In some cases, it might even reduce it slightly due to numbing nerve response and cause a dry mouth. Fact check number 2. You don't just walk into a hospital, say my kid is drooling, and walk out with 2 salivary glands removed. This is a highly invasive procedure that involves risk, imaging, multiple assessments, and a clinical threshold for approval. Fact check number 3, Sialorrhea isn't diagnosed from one visit. It's observed over time, and Gypsy's condition was well documented. Her rare genetic disorder is one of the leading causes of this problem. So the idea that her mom caused the drooling with Orajel, it's medically impossible, it's delusional, and yet Gypsy continues to push this narrative publicly, repeatedly, and without correction. In real medicine, before salivary gland surgery is ever considered, doctors try everything else. Speech therapy, Botox injections into the salivary glands, anti-cholerogenic medications, and behavioral modifications. Gypsy went through several of these options first. According to the reports, she did receive Botox injections that were only temporarily effective. Her drooling was persistent, pronounced, and distressing. Doctors then recommended the submandibular gland excision. This is a last last resort, but for evidence-based treatment for intractable Sialorrhea. The surgery wasn't a whim. It was a clinical decision made by trained professionals who saw a medically fragile girl with real problems. And here's the kicker. Even today, Gypsy reportedly still struggles with dry mouth and swallowing issues, side effects that often happen after salivary gland removal. That alone confirms the surgery actually happened and wasn't some fantasy cooked up by Dee Dee. Now, Gypsy also continues to have excessive salivation as well. So she circulates between dry mouth and excessive drooling. It took care of part of the problem, but it hasn't fixed the whole problem. But according to her, it was unnecessary. Let's be clear. Gypsy Rose Blanchard has experienced some amount of trauma. Everyone has experienced some amount of trauma, but trauma doesn't justify rewriting medical history and schmurdering your mother. She now denies having any real medical condition. She claims she was never truly sick, that everything was a lie. But this kind of denial is incredibly dangerous, especially now that she has Aurora. By erasing her legitimate diagnoses, she's risking neglecting her own medical needs, and worse, she may ignore those of her baby should they inherit any part of this genetic condition. And she swears that Aurora doesn't have it, but we don't know that's true or not. And if she's ignoring this baby and the fact that this baby could have this condition and have some of these problems going forward, it's going to be a very, very messy life for poor Aurora. So, and let's not forget, this isn't just about Gypsy. It's about every survivor who needs the truth of their medical history to heal. And real victims of Munchausen by proxy, whose story now gets clouded by Gypsy's chaos. Gypsy has legitimate diagnoses. She legitimately was sick. Her mother did not have Munchausen by proxy. Her mother was a mother trying to understand the very complex condition that Gypsy Rose has. So, what's the truth about the salivary gland surgery? It was real. It was medically necessary, and it was done in response to a serious, observable condition caused by a known genetic disorder. The idea that Orajel was some secret weapon used to dupe doctors, that's not just false. It's harmful. The more Gypsy insists that none of her medical problems were real, the more she endangers herself, her children, and the public's ability to understand what real abuse and real illness look like. We owe it to the facts and to the people still living with 1q21.1 deletion syndrome to get this right. We owe this to victims of real Munchausen by proxy. Thanks for watching. Like, comment, and subscribe if you believe truth still matters. Have a good one from the Good Wives, serving up true crime, one dish at a time. Bye, guys. Mwah.